clip, and then I would like to answer. I mean, I would like to ask 3 questions. I mean, please listen carefully, those 3 questions, and then later I don't want any, I mean, due to time constraints, if somebody can answer, that's fine, but then we'll make it very short. So 3 types of questions. First is say what, right? Why I'm playing this video clip, and second is know what. So you have to focus and say what is going on there. I mean, just what you see and what you hear. Third, so what? That means your interpretation, right? And then we'll use this video clip to understand what psychology is. So please bear with me. We'll go through this. This is only 1 minute clip, and just let me know your opinion. Otherwise, we are running out of time. We'll just I will tell you what it is exactly, right? So please focus on this video clip for a while.
Dạ lúc nãy sao? Dạ.
Right. Can anybody say about this? Anybody who can answer those 3 questions? One volunteer. Say what means, why did I play this clip? What do you think? And secondly, know what? That is a running commentary, like without jumping to conclusion. So third part, so what? That is, what do you understand? I mean, what is the analysis of this part? Anybody? Well, I think, right. Anyway, let me start, begin by saying that, in an interactive session, we give them time, to think about it and to contemplate what it is. Actually, you could see this video clip. It's a brief part, but, it carries a lot of messages. But before that, I played this video clip to understand what psychology is. That is what, the first question, that is say what, right? Second, now know what means, you focus, you concentrate on what is there, right? Your what you see and what you hear, right? So without jumping to conclusion, without other thoughts, that is the concentration part, attention and concentration. So finally, so what do you get out of this? How can you say what goes through your mind, right? So this is exactly what we try to gather from the audience, so that we get some idea about what psychology is, right? So with that, now what can you say? Can you say about what psychology is? It is the scientific study of mind, emotions, and behavior, right? So there are 3 important factors which I mentioned now. So one is mental process, mind. Second part is emotions. Actually, there are subtle differences. I'll let you know later. I mean, I'll just try to explain. And then the third part is behavior, right? So how can you understand this part? So we'll go to this presentation. I'm not going to take give you a long presentation, but I just want to have some visual, visual things so that you can see that and you can contemplate or understand, right? Uh, right. So look at this picture. This is what do you mean by mental process? The moment you say mental, people get scared and they think it's only psychiatry or abnormal mental state, right? But what do you mean by mental process? It's a mental process, right? You see, now I have played this video and now I'm talking to you all, right? You're listening to me, right? So the initial part is in the mental process, the focus, right? Your attention and concentration. That is very important, right? The second part, if you sustain that attention, that is called concentration, isn't it? And then you see and then you hear, right? And then what happens now? With that you interpret or what goes through your mind. Sometimes you would compare with your past experience or existing knowledge or the future plan. Here I have asked you to answer these questions, so you would understand that what I gather from this is what you call the mental process, like problem solving, decision making, right? You start with focus, attention, and then concentration, then thinking part, right, where you think about that, and then finally decision making and problem solving. So basically now what we mean by right mental process, mental mind means it's thinking brain, right? So if you see these pictures, you say we have an important part in brain we call prefrontal area, right? So we are blessed with that, alhamdulillah. So this is where we have this thinking part, where we can pay attention, right? And very important part of this thinking brain and also the mind is that we can you know we can delay our response, and we can really be patiently look at something, right? So that is also we'll have to see this. And then also imagination is also kind of a mental process. So the mind means thinking brain, and which is in the brain itself is in the forebrain, we call it. If you see, if you know the structure of the brain, right? Right now, what do you think about animals like monkey? Do monkey have this mental process or mind? Anybody? No, right? So it is what they say is that part of the brain is not very developed in animals, right? Whereas in human beings, it is far developed. That is the reason why we have this ability to think and make decision and think about the past and future, right? The same mind may cause problems for us. That is where we say mental health disorders, right? So whereas the animals do not have mental health disorders, though we say things, but it is not so, right? Those are uh, this is what we have to understand from the mind part, right? Now, second component of psychology is what you call emotions, feelings part, right? Now, look at this. How can you understand feeling, right? Now, you see these in layman's terms, we say head, heart, hands, and habits, right? There are four H's, and also health. Now, head means mainly we say thinking or mental process, right? Then heart, usually we attribute heart for emotions, feelings, right? But actually, we have a part in the brain we call the limbic system, right? Which is responsible for brain, emotions, right? Now, you say, look at these faces and you can see or you can identify hope. So usually what we do is in interactive session, we just show these images and then ask the audience to name, right? And of course, I mean, most of them, almost all of them, right, are able to say were able to say the type of emotion people experience by looking at the face, right? So you could see that first picture is what this lady is very angry, right? And second one is this person is very anxious, right? This is disgust, this is surprise, and happiness, and also sadness, right? So so look at these emotions. So this is the second part. In addition, we have other emotions as well, but these are major emotions which we are talking about. In addition to these images, we have love and affection, right? And also deeper, we call jealousy, right? And then also suspiciousness, right? All these kind of these are called emotions. You all know, feelings, right? So how do we say that feeling? While talking to people, we say we attribute that to heart, or we say person who is heartless means the person who gets angry, who doesn't have remorse and guilt, right? And then also you say love, the symbol of love. We say heart, my heart, right? And you see, when you feel anxious, you get palpitations. Yeah, when you feel sad, you say my heart is heavy, right? These are layman's term, but then to understand, what feelings are, we say this heart. Mind means brain, but actually the emotional part, the area which is responsible for emotion, lies in the brain, right? Okay, the third component, right? We'll come to that. That is what you call behavior. So, what do you mean by behavior? By the way, this what can you say about these emotions? Do animals have emotions? Right? Can you identify them? Well, these are exaggerations, of course, but yes, animals have emotions. But by looking at their non-verbal messages, it's pretty difficult. But except some emotions, right? Like anger, and then surprise, and then, right. But it's very evident among human species, but not other animals. But it is to some extent. But do have emotions, right? The mental process part is not there so much so as in human beings, right? So the third component is pretty obvious to all of us. That is behavior, right? So behavior, we say by hand, but not only by hand, but by mouth, right? This is the product of emotions and mind, mental process, right? So we say hand because we do mostly hand, and then we have this what is called a well-developed system, right? And also we use our hands and all, the body basically to behave, or activities, I would say. And then also uh, so we will verbalize, right? So these are called behavior, right? So yeah, uh, so far anything uh, any problems, or any, is it very clear? Yes, can I hear from one of you, please? Mrs. Tasi?
Yes, it's clear, Dr. Singh. Please go
Right.
ahead.
Okay. Now, coming back to mental health, now, what is the link between psychology and mental health? Now, before we go there, now tell me, you know, any event, if there's an event, right? Uh, what starts functioning first? Now, what type of person are you? Now, the difference between response and react, uh, right? Uh, Reaction and response. So anyway, now tell me, there are two types of people now, many types, but even as an individual can act differently, at different circumstances. But generally, so how do you act? I mean, when there's an event, do you use your brain first and then feel it and then you act, or is it on the other way around? Like you feel first and then act, and then you think later, right? The third part is you don't think, you don't feel, you act, right? People do differently, right? We say some people are emotional. Emotional means sometimes we say impulsive. We don't think about the consequences. That means we don't use the thinking brain part, right? And then some people get highly emotional, and then they get what you call emotional hijacking, right? That could be for positive emotions as well. Now you see, we say sometimes love is blind. Then after marrying a person, only you realize how silly or how mad I was, right? Later, and then likewise you get angry sometimes, right, out of proportion. But later you realize, why did I get so angry for that so trivial issues, right? But some people are, very careful, right, prudent, and then you see, and then they think, and then this suburb we call these, right, they're patient, and then they will act slowly, right, patiently, and then intelligent, right? So this is people can differ, right? With that, we'll come to this health part, right? Now, you see, this is, I don't want to go into bombard you all with, real scientific, what do you call, explanation of what health is. But yeah, but you see this part, right? Health is a state of complete physical, mental, and social well-being, right? That I think most of you all know. But see the second important part, which people they don't focus on this part. It's not merely the absence of disease or infirmity, right? So if you look at this picture, now we'll take this physical health, right? You know that these children may not have, very likely they may not have any disease, right, or disorders. But look at them, right? What can you say about this child, right? And what about him? And also, these bodybuilders, that is the other extreme, right? Merely the absence of diseases does not, say 100% that you're healthy, right? So if you are at risk of developing any diseases, right, like this, obesity is a major cause for diseases in the future, and we call this at-risk group, right? So that is where we need to understand it's a spectrum. On one end, you get really healthy children or healthy individuals, right? Who really work, do exercise regularly and very mindful of what they are eating, right? And also, they don't smoke, and they don't do other things like risky behaviors like taking alcohol, right? So even you hear from these people who take alcohol and who smoke, that despite these habits, they dismiss that it can cause other certain deaths. But definitely these higher risk, we call at risk things are well established, right? So here, uh, the more you go towards the left side, right? We say you maintain your BMI and then regular exercise. Then you say you are in a very positive spectrum of physical health, right? So, what can you say about mental health, right? That also has a spectrum, right? We only talk about what we call the disease model, and then also the moment we talk about mental health, people think of severe psychiatric disorder, right? That is what you call psychosis or schizophrenia, right? Right. So where people are deluded in the sense they have abnormal beliefs, and they're muttering to themselves, right? And then some are very aggressive, not all of them, right? And then the moment we say about mental health disorders, people immediately get that images, right? So that is one of the biggest mistake, or things that we have it in our, not only in our community, but it's common everywhere, right? So you see, the positive side, or the, before you understand what exactly the spectrum, we'll come to this part. So the physical health, it's quite easy to understand, but people don't really get what exactly psychosocial health is, right? So these are the four important parts, right? So this is emotional health part, feelings, right? Then social health, relating, relationship, interpersonal relationship, right? Then the mental part, as I told you, is the thinking part, right? And then spiritual part being. So according to WHO definition, right? But there are some controversies. But then, so usually it is all four components are there. So they combine emotional and mental health together as a mental health, right? Though there are differences, but this is a cognitive health in real psychiatry. But then these three components, in addition to physical health, are very important, right? So we tend to exaggerate or give only importance to physical health rather than the mental health and the social health part, right? So unless and until you have all well-being equally or together, you can't label you as a patient, person with good health, right? So what do you mean by emotional health, right? We'll try to understand this. So how can you say that you are emotionally healthy, right? You see, we can give a certificate, or we can screen people, the population, and say that they are healthy. How do we do it? You all know, I think you are aware. So we do what we call uh, BMI calculations, right? We ask them about their behaviors, right? And then also about then we can say roughly by measuring, right, BP, doing blood checkup, right? Even though they don't have symptoms. So then we say we categorize them as healthy people, right? At risk, or people who have diseases without symptoms, right? We do see many people, right? Even cancers, you find the lump, people don't notice it, right? Some diabetic patients who have these in the blood, when you check them their blood sugar, they incidentally we find many diabetic patients, right? So BP, they can have it without headache, right? So likewise, you see mental health, you see in one end you will see people who are who have a very positive mental health, right? So here, what do you mean by mental health? As I told you before, uh, thinking part of psychosocial health, right? Mentally healthy people tend to respond in positive ways, right? But mind you, don't people talk much about positive thinking, right? Positive thinking is fancy word, right? Whatever the adverse events or whatever the situation, you have to always think positively. Is that correct? No, right? You see, think differently, right? So think differently and see whether you have any thought distortions, we call it, right? Or is it according to the situation? So what I mean is mostly, right? Mentally healthy people tend to respond in positive ways. So irrational thinking may indicate poor mental health, right? Now you see, there are situations, like optimistic thinking, optimist and pessimist, right? So what is the difference between optimist and pessimist, right? You see, any situation, a difficult situation, an optimistic will see as an opportunity to grow, right? So a difficult or a good, a healthy situation, a pessimist will see as a challenge, not a challenge, a threat, right? Will play down the importance, or whether it will be to their benefits, right? We'll always think about the negative. The famous saying about half full, half empty cup, right? So yeah, that is exactly what you call people with mentally health people tend to respond in positive way, means in an optimistic way, right? Even I think you all are aware, some of you must be aware of the meaning of what you call innamal, vainamal usuyusta, innamal usuyusta, right? Not mal means with, not bad. That means not after. So the meaning is very clear. So any adverse events Allah has given to us, there's something, some opportunity in it, right? So if you think that way, that is what you call optimistic kind of thinking. So this is one thing I would like to stress upon. And then secondly, the emotional part, right? You see the feeling you. Emotions are complex feelings. We say this about love, hate, frustration, right? And how do you, what is your emotional state most of the time, right? And in most of the days, right? Is it, is it proportionate to the situation? Does it last longer than what is it is, with the circumstances warrant, right? So these are very important things to understand, right? Emotional awareness, and then emotional health. That is the second part, right? Right. Now you see some very talented, and then some have it. This is what we talk about. I don't know whether this is too much for you all. Now the new branch of psychology is called positive psychology, right? And there are two types of happiness. They call hedonic happiness and then eudaimonic happiness, right? Hedonic happiness is mainly emotions, right? Where you feel it, right? The joy, and then situations which make you happy, and then you right, uh, elation to some extent, right? And you have mostly the positive emotions, the absence of negative emotions, right? Absence means relative absence. I'm sorry, not absence, right? We are human beings, so we are prone. We can, our emotions can fluctuate depending on the circumstances. But if you really look at the overall picture, this relative presence of high presence of positive emotions and relative negative presence of absence of negative emotions, right? So if you see these people, I mean, this is there are two types of smile. I don't know whether some of you are aware. We call it Lucians and Pan American style, right? Smile, right? So this is what can you see if you look at these two pictures, right? This is I'm sorry, I'm taking I don't want to spend more time because of time constraint. You see, look at these pictures, you will see this is right, a genuine smile, right? And this is not genuine, right? And you see, there are several studies being done, right? After looking at these what you call group photos of the students, right? And they have followed them through, right, for 20 years, and they found out what is the consequence. I mean, how their life is, how life satisfaction, and their other indicators like are they happy with their marital life, work life, and happiness. So and then also the prevalence of addiction and so on. So this is the positive part of what you call mental health, right? And then social health is also you all can understand from these uh, slides, right? So what do you mean by a person who is socially healthy, right? A person who can really develop relationships, right? Handle conflicts, in an appropriate way, right? Without going into what you call conflict escalation, right? And then also you see some have that skills of, right, communication skills, and then also to understand with, empathy, and then also and to sustain that relationship and to repair the damage if there is any, right, in no time, right? So this is also a very important part of health, right? Okay, now coming back to what you call mental health. Now according to WHO, right, there are four components actually, just for the sake of understanding. I mean, I'll say briefly. One is how can you say a person is very healthy, right? Well-being, right? One is we say self-awareness and self-confidence, right? They feel good about themselves, right? And also they know their strengths and weaknesses, right? So this is the first part. Second part is actually this one, like this is ability to cope up with day-to-day challenges. Or in other words, uh, ability to you know they have the coping skills to daily stresses, like whatever it is, they can cope up well and they can manage their stress well, right? They can control tension and anxiety. This is the second, right, part, very important thing in mental health. Third component, they can work productively and fruitfully, right, regardless of what work they do, right? For example, you may have noticed some doctors, though they are intellectually very intelligent, they're doing very well, right? Even including skillful doctors are there, but on the other hand, they are emotionally they are very poor, right? And probably the productive level may be very good, but then fruitfully, I doubt it's some doctors, right? And then also you see, even if you're intellectually, or if you have many qualifications, right, doesn't guarantee you that your productivity and is will be guaranteed, you see. So that depends on your mental health, right? Even being a housewife, you see, right, it depends on your mental health. So in other words, so if you can't really function productively, right, and fruitfully, so that means there's something wrong with it, right? And then the final things, ability to you know form relationship with the society, with the others, your family members, your family, right? And also, as I told you, basically the social health, right? So if you have all three components, so we say uh, you are mentally fine, right? Now you see this mental health spectrum continuum, right? On one hand, on one extreme, you get distress, negative emotions, which is associated with your thoughts, right? That is, and the other side is positive mental health, right? Now you see, you have to understand, but this this picture is basically we play this, we show this picture to counselors to understand the mood variability of human beings, right? So a healthy person also can have, I mean, mentally healthy person can have this, morning he can be highly distressed, towards the evening can be, right? So depending on the demand, depending on the challenges, right? But what I mean by mental health spectrum is over period of time, you see. So, right, many people now, we have to consider the situation, right? Suppose if somebody lost his spouse or a child, right? Then definitely that emotional, we say sadness, will last for some time and will be very severe. So we don't label them as a psychiatric patient. So that is a normal grief response, right? But you see, if it is disproportionate, if a small event, right, and you behave as if you have lost a big thing, right? And then even after, you know, after demise of your close ones, right? If it is lasting for a long time and without any improvement, that means there's something wrong, right? It is not normal, right? Also, if you're faced with challenge, faced with a challenge, right? Suppose if a student is facing the exam, so exam stress is very important, right? But if it is too much, so that is something we have to think about, right? And then also, about this panic, right? The other side of what you call anxiety, the extreme of anxiety, right? So here you see, one end you get very healthy people, the other end you get severely disturbed people, right? With mental state, right? So here, now one thing goes beyond this. I mean, in addition to what I said, that is severe psychotic disorders, right? Where they have, we call hallucination. They see people when there's nobody. They hear noises or voices, right? When there's nothing, right? But they're very clear about it, right? So that is the very abnormal part, which I'm not talking now, talking about. So that is the severe psychiatric disorders. But here, in between, there are many, right? So the very commonest is a depressive disorder, right? And then anxiety-related disorders, right? This is highly prevalent in our society, not only our Sri Lankan society, our society in the sense, right? And then you see, if you go towards the positive side, or some parts, some people do not have what you call depressive disorders or anxiety related disorders, but they have what you call stress, and then also issues like personality issues, right? And their mental health is compromised. They have not come up to the level of to label them as mental health disorders, but their mental health is compromised, and it is towards the negative side, right? And then the positive, many people on the neutral side say, and then very positive people, as I told you before, will respond and will have a relative absence of negative emotions, right? And will have very good opinion about their life, the past and the future, right? So this is what you call the mental health continuum part, right? Okay, finally, with I would like to say about these three components. I said, I think I have mentioned about that, right? Satisfaction with present life, relative presence of positive emotions, and relative absence of negative emotions, right? Right. Now, what do you mean by mental illnesses, right? I will just touch upon these and then get your feedback and then see where which direction will move forward. So I would love to get your questions, right? That is how we do programs, right? Otherwise I can focus on one topic. So it all depends on the feedback from the audience, right? uh, okay, now so what do you mean by mental illness? So mental illnesses are disorders that disrupt thinking, feelings, moods and behavior. So I think you'll understand now. So disorders that disrupt thinking, feelings, feelings and moods are different, and behaviors, right? And this one more, we say belief and perception, right? So if these things are not in order, disorder, right? It is disproportionate. And if it is, if those things are, uh, uh, lasting for a longer time than the expected time, right? So then we call it mental health disorders, right? So what do you think about the prevalence in the society? How many people are suffering from mental health disorders in the society? Not mental health, poor mental health, but mental health disorders, mainly mood disorders. What do you think? They say 1 in 4, right? So this is it should be more now, right? But there's a range. They say from 15 to the prevalence is 15 to 25%, right? So if you see how many percent, what is the prevalence of mental health problem, people with, poor mental health, it's more, right? You know that most of us can't manage our stress, right? We have interpersonal issues, right? If it prolongs, if it goes on for a longer period, it will eventually end up in mood disorders and other issues, right? So so this is what I think I wanted to say in the beginning. An outline about what mental health, psychological health is, and then also what psychology is, and psychosocial health, and you would have understood, you would have gathered some information about what you call the mental health spectrum, and then mental health illnesses, right? With that, well, I would like to ask, I mean, Tasi, means Dahlan, have I taken longer time? What time is it now?
It's almost 9 o'clock, Dr. Shiyam. So if you'd like to take some questions from
Yes.
the audience.
Yes, please. I would like to. I hope that this is okay.
Yes, it's fine. Thank you. So we have
Yes.
a few questions. Ramla, Shifa, over to you.
Yes.
Jazakallah khair. Yes, Jazakallah khair, doctor, for enlightening our youth. So we will move on to the question answer session. So if any one of you have any questions relating to the topic discussed today, please raise your virtual hand or you can unmute and speak. Also, Ramla, over to you. You can proceed if there are some questions on the chat box.
Yes, okay. Thank you, Shifa. Okay, there's a question from Sister Tazi. She says, Dr. Shiyam, there seems to be a stigma attached to mental health issues in Sri Lanka. Many brush it off like it is something to be ashamed of. How can we break these taboos in our society and be more accepting and understanding?
Well, it's a good question. Actually, destigmatizing is one of the most important parts. I really expect your team to focus more on it, please. I think I'm sure that Ms. Dal Antasi is more involved in that because of so many issues I can understand. You see, there are few reasons why we have this stigma, right? So the major reason we think that people with there are many what you call myths, right? So if you go to Candy Hospital, you will see a beautiful what you call uh, thing written on the wall. They say a question, who will have mental health disorder? A person who has brain, right? Anybody, including myself. So that message is very important, right? So it is not those who are very weak, right? Many scientists, many celebrities, right? They are coming out openly, right? So that is one thing which we have to, get across, right? Say that anybody can have it, right? And having these mental health disorders, right, is not sign of weakness, right? So that is one thing. And then secondly, these in the movies and then when people talk about things, there are two extremes and two important things which they depict. I mean, they try to get across through these movies. One is that men people with psychiatric illnesses are very
No,
aggressive.
I
They are
don't
very
want
violent.
to. I'm not dressed properly. Leave.
Yeah. And then second is they make fun of them, right? You see, this is the other part. And then third part is people are scared of what you call treatment, right? And also, in the culture, we like to, attribute this for other things like gene possession, right? And then those kind of things. So these are the issues which are creating problems. Actually, lack of awareness is one, and then second is about we think that only weak people can have mental health problems, right? And then some people go to the extent that they say that if you don't follow Islam, but you need to understand that Islam and the Islamic principles or religion, spiritual health is really beneficial, right? But does not guarantee, right, 100% immunity. Allah knows best, right? And then you see that kind of what you call the perception among the society is what is what the society is talking about. So this is what we have to focus and make them understand, so that the our community will seek treatment, right? Only one third in Sri Lanka, I think, should be more than that, right? I mean, less than that. Seek treatment on time, right? In Western countries, only one third come for treatment on time. So they don't come. So they come after the damage is done, right? And so that becomes a problem. So it's a good question. I mean, have I answered that question, Tasi?
Thank you, Doctor. Yes, thank you very much.
Okay. Yeah, there are three. I saw
Your
three people.
hand is raised, yes.
Yes, there are 3 hands raised. If you could unmute your mic and ask a question, please, Dr. Marina.
Yeah, Assalamu alaikum, Shiyam. This,
Walaikum assalam.
we see a lot of depressive, anxiety, depression, and suicidal attempt of youngsters, especially with their gadgets and seclusion from the parents, and not really having interactions with the parents or the peers or even siblings enough, and so on. And we come to know that these people are suffering from this. Sometimes it's too late.
Yeah.
So what are the advices you give the parents to look for, and how to diagnose them early? Because nowadays you can't say they are secluded or introverted. I mean, they are, all of them are into their phones, so you don't know if they're even secluded or not.
Yeah.
What would you advise the parents?
Yeah, this is very important. How to identify them. You see, I have a presentation on young adults, typicals of trouble. You see, these is a very difficult situation. Now we need to understand what is normal and abnormal among the adolescent, mainly teenagers, right? And you see, these there are I don't know whether you all are aware of what we call the psychosocial stage, right? So that is a very crucial part. Now we say about this identity and role confusion, right? So nowadays we have that issue, and we have to address those issues, right? Understand the psychosocial stage, and the environment is also as such. Now, by the way, I think I didn't mention what causes mental illness. There are we call biopsychosocial model, right? Some genetics, and then for some people it is predominantly genetic, but mostly it is psychosocial, right? So psychological perspective, this parenting part from the beginning, and also the society, right? And then also put social media, for example. These are, and then the present pandemic, with self-isolation and all. I mean, this what you call less interaction, and then the educational system, everything is all are contributing, factors. So what I can say, there are some features, right, to say that they are not normal, right? And you will have to intervene. So best thing is to intervene, identify them, and then go for assessment. Now, simple thing is, there are some screening tools, and the parents must know, in the form of awareness, we have to do that. But best thing is to do preventive part, right from the beginning, prevention. This is why I stress always the importance of having a positive parenting or parenting classes, right? And then you see things like if they are usually we say these early teenage, they become irritable, you see mood fluctuation. But if it is you know out of proportion for a long time, right, and it lasts for a long time, right, and then if they express suicidal ideas, if you find that they have these what you call, they threaten with this, and then you see if you see their behavior has changed, right? And if they start crying unnecessarily, I mean, or with some events, but then these are the things we will have to look for, right? And also you see school resistance, right? And then if the performance is going down, you have to seriously think about those, right? So there are some screening tools, screening questionnaires, right? By which you can say, but I think we'll have to give those screening tools to the parents, right? To tick it and what they observed, right? And then do an assessment. Simply, if they threat the parents and others with suicidal ideas, if they are demanding more money, right? You'll have to suspect other things as well, like substance abuse, right? And then if you see their mood variations disproportionately over a long period of time, right? And then intellectual deterioration, I mean, is what you call intellectual, academic deterioration, right? So interpersonal conflicts. So these kind of things will give you all some clue, right, about the mental health of the youth, right? So did I answer, Marinanti? Is that all right?
No, still, the problem is because I get a lot of people coming from the counseling. There are lots of problems with the present generation. One thing, they are anyway withdrawn from the parents, most of them, because of the home. So the parents don't know. Second is the parents don't want to accept the fact that, the child may be in need of help, especially psychological. So they say, no, it must be, they are being adamant and, stubborn and things like that, and they don't recognize this problem. Third one is, I have had a few cases where the child themselves, like about 18, 20, around that age, because of reading, they themselves diagnosed that they are having anxiety depression. Whereas it took me some time to convince the parents, right? They say, no, can't be that, must be, something happened in the school. They hang on to a small thing. So what I'm trying to get at is probably we'll do a longer programs, especially even calling more youth to participate also.
Yeah.
How to identify either themselves or the parent. All the points that you said are true, that it is, if it's very apparent, right? Now, say withdrawal, falling in class, and social, these are sort of practically the norm nowadays. So it's a little difficult to diagnose. So we have to have some where people can talk. When youngsters feel low, that we should have some places where they can call and just have a chat or something like that. Okay, I'll let go. I'll get the other people to answer. We'll do a continuation of this for the youngsters, inshallah.
Inshallah, right? Okay.
Dr. Shiyam,
Yes,
we have another question.
Yes.
We have another question, Dr. Shiyam, from Aisha Hilma. Doctor, for the one who gets migraine, do they get furious and shout, and they get severe headaches, and they show their emotions to their kids and husband? Any solutions, and can I meet you personally? This is from Aisha Hilma. Thank you, doctor.
Well, I'm in Oman, so if you can come to Oman, you can meet me personally anyway. But then, one thing I forgot to say, this is among the youths and females, even Asian culture, is something called somatization, right? So you have to be very sure whether you are suffering from migraine or not, right? There's another entity called tension headache, right? And also, you see, yes, due to migraine, if it is severe, you may see that, the level of the, we call threshold of tolerance goes down, and as a result, you may become irritable. So that is a possibility. I wouldn't jump to conclusion, but usually they don't respond that way. I mean, when you get an episode, so you have to see what comes first. I mean, is it the thinking and the stress comes first, or the other way around? The headache came first, right? So many people now, through Dr. Marina's question, this is also very important. So young people, many people come with the complaints of physical symptoms, to see that they have these the psychiatric disorders like low mood, anxiety, but they don't know how to express themselves, and also due to stigma, right? And there's something called psychological defense mechanism. This is what parents and the others have, so we can't blame them. We call denials, right? And then also rationalization. So the worst thing that a person could think of is psychiatric disorder because of stigmatization, right? So they attribute and then they try to minimize. So so coming back to your question, I mean, you see whether you really have a migraine, right? Even migraine can be precipitated by stresses and mental health disorders. I wouldn't say that you have mental health disorders, right? And then you see, and then there are drugs which can, help you. And then also about one thing I must say very clearly about the role of counselors, right? That you have to be careful, right? Counselors can do counseling, supportive part, but then you see in the spectrum, if you really see, the diagnosis can be made only by psychiatrists and clinical psychologists, right? So if they find that is, the spectrum is towards not towards what you call negative psychiatric disorders, then yes. So what I do is I usually do both psychotherapy as well as the drug treatment, right? And you need to analyze your past. Then we say ABC chart, activating event, behavior and consequences, right? And then also the type of physical symptoms. Coming back to that, not only headache, people, many women and adolescents come with symptoms like gastritis, right? And then we call even irritable bowel syndrome, loose motions, like, and alternating with constipation, bloatedness, right? And then aches and pain, there's a condition called fibromyalgia. Actually, mainly is for most of them, it is there's some underlying psychological issues, right? So this is we need to understand. So I really don't know, sister. I mean, we have it. So what is first? We'll have to analyze it, and then accordingly we need to treat, right? So the other possibilities people have, we call dual diagnosis. They have migraine and this, right? And then also some relaxation techniques, right? And like mindfulness would help, right? And also CBT perhaps. So even so those things we'll have to analyze, do an assessment, and then give you a formulate a what do you call course of action. Okay, did I answer your question properly?
Okay. Yes. Thank you so much, Dr. Shiyam. We have the Sister Farina. You can unmute and ask your question.
Yeah, I am. Yeah, Dr. Shyam, I'm just voicing, actually echoing Dr. Marina. She took the words out of me. And then that is today's youth express different behavioral patterns, as we see. Most often withdrawn, aloof, impatience, getting angry, irrational behavior, and most of the time being loners, staying alone. So could substance abuse be a reason for this? And does substance abuse lead to bipolar or schizophrenic symptoms as well? And those who are diagnosed as bipolar, as having bipolar disorder, etc., do they have to be dependent on medication for life, or is it a gimmick that's used by psychiatrists most of the time to keep them? We find that I've heard of quite a few patients whom I know who are like hooked onto medicine for life. I mean, do they need to do that? Is there any way that they can do to get out of it? What would you advise to patients who are given medicines for life? They've got to take those pills every single day. Because in fact, there's a particular psychiatrist whom I've heard saying, I mean, I have very high intellectuals coming to me, pilots and engineers, but they need to take their pills every day without missing a single day, or they're going to, it's going to backfire on them. So this is some kind of advice that we need on this particular issue. Should they be hooked onto medicine for life if they have such mental disorders as being schizophrenic or bipolar? And is psychosomatic illness also a part of mental illness? Would you say that? I have a lot of questions for you, Doctor. Thank you.
Yeah, there are many, right? Well, great. I mean, I would like to answer one by one, but I really wonder whether we have time. But, I will go from the interesting part for me anyway. Whether, if a person is diagnosed with a psychiatric disorder, whether he or she needs drugs for life, I mean, throughout his life. So it depends. Now, a patient who is being diagnosed as bipolar, right? We have a protocol, right? Schizophrenia, right? These are recurrent disorders, right? Now it depends. Now I have seen some patients. Now, what the recommendation is, now if a person is diagnosed as having bipolar, so first episode mania, If it is mild, so we treat them and say we treat them for 6 months, and then we discontinue, and then right. But then you see, if it is a severe episode, if there's a family history, we say we can predict to some extent, not 100%. And then also they get recurrent episodes. By the way, bipolar, I hope that most of you are aware. So mania and depression, right? So some people get only many episodes of mania and mild depression, right? So depends on the frequencies and severity. So then many will have to be on drugs, right? Otherwise, what will happen is the quality of life will be compromised and be very difficult to control. Schizophrenia is a severe form, right? Uh, right. So the bipolar people function between interepisodically, right? Coming back to the other disorders like depression and anxiety-related disorders, this is controversial. I do admit some are medicalized, right? Because of relative absence of proper psychotherapists and the time, right? And then also people's, some do not want, they're impatient. They want quick recovery. And also, the ideal thing would be to try psychotherapy for anxiety and depressive disorders, right? Not for bipolar and schizophrenia, that is out. It should be, by medication. And sometimes we combine. I personally feel that we need to try focus more on psychotherapy first, in which you combine, and then I try to tail off, and many are successful, right? And we see relapses, so we have to prevent the relapse. So where psychological and social interventions are very important, right? Unlike other these things, right? So that part is not taken care of, I admit. So that is one thing which I want to focus on, like group counseling, group psychotherapy, right? And then also to educate their parents on how to manage or how to help them, right? Then the other part, psychosomatic diseases, right? Psychosomatic diseases, mainly, is some underlying diseases, psychological problems or psychiatric disorders, right? That is manifested in the form of physical symptoms, right? So that is also very common. And then the first question which you asked, whether this substance, there's by-way relationship. Now, many undiagnosed psychiatric patients, especially among the teenagers, they self-medicate in the form of what you call substance, right? So I have seen many with social phobia, right? Then anxiety-related disorders and depression, right? They go into addiction, and then finally you label them as addicts or dependents. Rather, the reason why they have gone is underlying mental health disorders. The other way around, people without mental health disorder, with poor psychological health, can go into what you call addiction. Then later they can develop as a result what you call psychiatric disorders. We call it substance-induced psychotic disorders, right? So this, which is also very common, especially cannabis-induced, we call schizophrenia, right? So this is what we need to understand. And also, I think coming back to this question, if I can remember well, right? This, I don't know whether you all have read a book called Emotional Intelligence, right? Where that book talks about schooling the emotion, the components of emotional intelligence, which is very important, right? This is where we have gone wrong. And then also the value system and the virtues of Western society, that we have taken without questioning, has created havoc among our society. So we are going towards that direction, I suppose. I mean, right? Is loneliness, feeling of loneliness, and things like that. About this individualistic society rather than collectivistic things, right? And then we don't really promote what you call connectedness, right? We discourage, saying that in the form of what you call independence, which is needed, of course. But so these are the issues which we will have to think about, right, in prevention. And also, there are many, so we will discuss about it in the future. I hope, sister, I have answered most of your questions.
Yeah, thank you, doctor. It's a very gray area, and due to lack of knowledge, it's not deciphered properly. But inshallah, with your inshallah future
I
interaction
didn't
with you,
get
I'm
it.
sure.
Tell me again.
Yeah, this is a very gray area. Thank you so much for your information on this. And due to lack of knowledge, I think this is not read properly. The symptoms and signs and lots of things pass by. And inshallah, with TMN interaction with you in the future, I'm looking forward to many more webinars with you. I'm sure we can shed a lot of light together. Thank you, brother. Thank you, ma'am. Thank you.
Thank you so much, Dr. Shiyam. Yes. Suha has a question. Yes, go ahead, Suha.
Doctor, are mental health issues, medically speaking, a lack of a chemical in the brain, which is why the doctors medicate the patients?
That's a very good question. I don't know. I'm happy that you all are coming with so many things, making it as an interactive session. For a psychiatrist to say that is something wrong with what we call chemical balance, and then and rationalize medicalization, that is the easiest way, which I also used to do in the past. Well, there are two sides we need to understand, right? Yeah, there are so for example, endogenous depression, right? Some have only family traits, and then even there are some conditions like hypothyroidism, right, where you need to you really see that thyroxine is is low. You treat them, and then endogenous depression, yes, and then even otherwise with psychosocial contributors, yeah, the chemical imbalance could be there, but it doesn't point towards real medication for life, or you have to do continuously ignoring the other psychosocial part intervention, right? I'll tell you an example. Now, you see, if you are facing with a challenge, right? Now, say exam, right? What will happen? You will experience physical symptoms. What will happen inside your body? Of course, chemical imbalance, right? Cortisol and adrenaline, and also in the brain. We say this about the GABA receptors, and then many chemical imbalances. Of course, I mean, by looking at it, you can stimulate your chemical imbalances within the body. It doesn't mean that you have to medicate them, right? Even in the form of relaxation techniques, and then making them understand, you can reverse that phenomenon. Now, you see these even sleep disturbances. Now you see people with anxiety, they have sleep disturbance. You medicate them with what you call sedatives, and then finally they get hooked on it, right? Do not, misinterpret what I say. There are situations where you need to, because to break the cycle, right? And then, but my opinion is it should be combined with psychotherapy, right? Or psychoeducation, and also the other things, right? So that is what I say, we need to understand that. But then, like psychotic illness, definitely it is more to do with endogenous, what you call chemical imbalance, so they need medication, right? Yeah.
Oh, thank you, doctor.
Okay.
Okay. Yes, thank you so much, doctor. There's another question from Asma. Yes,
Yeah.
she says, how to not act upon insertive thoughts as OCD patient. She says, I immediately act upon without thinking even, and I don't know why I should do some X, but I do just because of my brain. That's Asma's question.
I didn't get that question. Come again.
Yeah, she says, how to not act upon insertive thoughts as OCD, as an OCD patient. She says, I immediately act upon without thinking. Even I don't know why I should do some acts, but I just do it because of my brain. That was the question.
This is very interesting. I mean, you see, this is OCD is an example where you need to combine or do what you call, we call there's a form of therapy, CBT, but then mainly it is response prevention therapy, we call exposure and response prevention therapy, right? So to make it short, there are three components, four rather. thinking part. You know, there's like this sister say, intrusive thinking. So they understand the absurdity, and then the anxiety, you know, with that thought. And to prevent that anxiety, they do these rituals, behaviors, right? And then it goes on, and the behavior goes on, and you know, it worsens, right? Then initially they wash 3-4 times, and then again 10-15 times. Not only that, the thinking part, they try to neutralize, you know, like blasphemous phrases, for example, that it is becoming very common. So here now, rather than blaming it on the chemical and, you know, rationalizing it and then doing it, right, expecting only the drugs to work, best thing is to, as I said before, if you really change your behavior, mainly in the OCD, we try to change the behavior rather than the thinking pattern, right? Sister, this is a vast area. I mean, you need to understand. We will try to correct some people with OCD. Then, you know, then you will understand how to get over with it, right? So, or you can work with a psychotherapist as well as a psychiatrist, right? If it is severe, we do give medication thinking that it will help. Usually it helps, right? And then also combine with these behavioral response prevention therapy. I mean, response prevention therapy, right? I hope we will understand what prevention, response prevention, right? So there's a way of doing it. It's not that easy, right? So you have to do it properly, right? By jotting down, and then also, you know, gradually goal setting and things like that. So that is how we have to tackle these OCD issues, right? Hope I have answered to some extent.
Yes, okay. Thank you so much, Doctor. We have one last question.
Yeah.
It's from YEZ. His question is, Dr. Shiyam, you mentioned something to the effect that prolonged grief of a lost spouse is not normal. According to your opinion, what is the reasonable number of years to be able to emotionally move on after a strong relationship? And also, how to build strength in handling the triggers that occur with the obstacles of facing the challenges of life with the changes?
Yeah.
That's the
Now,
question.
yeah, very good. I mean, this grief period, you know, you see, you need to understand however close you are with the person who passed away or any divorce, right? Usually we say 2 months, or sometimes, you know, depending on this situation, 6 months. If it is more than that, not years. But definitely it doesn't mean that you will forget everything. You will remember that person, you will cry, but that will not have any major impact on your day-to-day functioning, social functioning, right? And and then if you see, if you compare the first day or first few days of grief, and then say towards after 1 month, 2 months, there will be improvement in the symptoms. You will accept it. There are some stages, we'll talk about it later, grief stages, right? So then acceptance is the very important part, and then you accept it, and you know, you move forward, right? That mindset, and then that function level is expected, right? If it is not, right, if it is deteriorating, right, then you need to intervene. That is we call abnormal grief, right? If it is very intense, some people go to the extent of you know, deliberate self-harm, right? So so these are the things which we need to understand, and then intervene, right? Otherwise it is a subjective feeling, but depending on the intimacy that the person had with the other person, right? So, and also the social circumstances, like a widow, a young mother with several children, right? So these are some of the things which we will have to consider, and then decide the duration, right? So this is the first question, I think. And the second question, I forgot. What is it? Anything else? Grief, abnormal grief? Right. That is the only thing you asked, or there's something else too, right?
The second part of the question was, and also how to build
Yes.
strength in handling the triggers.
Yes, we call resilience. it's an important part, Inshallah, we'll try to do that, how to develop resilience, mental resilience, right? In other terms, we push the community, your children, yourself, towards the positive mental health spectrum, right? It's a vast area which is fast developing, right? Then you will develop resistance to these triggers, right? And then there are some group therapies which we all must know. Even I personally was, my life changed after learning CBD personally. Though I was not a mental health person, but then the resilience part, I just got to know after I went through the severe stress, this COVID stress, right, with the patients. So, and then several issues like even the connectedness, how your life with your family, right? So those are investments you will have to see. So in other words, coping skills, right? You must learn these things and then also make sure that you develop from the beginning. We call this resilience, right? I don't know whether you're aware, there's a subject called psychosocial life skills. In the school, they teach it only for the exam, but they don't, do it in such a way that you inculcate those things. One is very important thing is coping with stress, anger management, and things like that, right? So decision making, problem solving, empathy, right? Interpersonal relationship, effective communication skills. These are the components. Self-awareness, right? So these are the things which will help you to cope with the triggers or threats and challenges. So which we have neglected. That is the reason why people are going, developing psychiatric illnesses. Right, major component, I would say. Okay, I think I have answered those two questions. Yeah?
Yes, thank you so much, Doctor. Yes, we have a few more questions, but I apologize to our participants that we have run out of time. So hopefully we could answer them next time. So I'd call upon Sister Shifa to give the vote of thanks.
Thank you very much, Dr. Shiyam. And on behalf of Kashmir North, the media wing of Muslim Civil Society Alliance, I would like to express our sincere appreciation and the gratitude to our presenter, Dr. Shiyam Farook, for his valuable contribution and the effort taken to share those most valuable words. Thank you very much, Doctor. And thank you very much, dear boys and girls, friends, parents, for attending this session. And we expect your attendance next week too. Further, we can't forget the support of Kashmir North My Rights Matter movement team, who are behind this effort. Thank you very much, my dear team. So then we'll conclude the session with a few announcements from Ramla. Ramla, over to you.
Okay, thank you, Shifa. Yes, so please share and like our page at Touch Me Not. You can reach us through Facebook, Instagram, Twitter, and YouTube. So I'm looking forward to meeting you all next week. So for now, I will end with today's proceedings with a dua. Subhanakallahumma wa bihamdika nashhadu an la ilaha illa anta nastaghfiruka wa natubu ilayk. Assalamu alaikum wa rahmatullahi wa barakatuh.
Thank you, Jazakallah. So I need some feedback, please. Yeah, thank you. Assalamu alaikum.
Alaikum salam. Thank you, Doctor.
Shiyam, can you stay on for a minute? I want to discuss something with you about the training session that we have been thinking of.
Yeah.
Yeah. Or maybe I'll call you. By the way, Shiyam is my nephew, right? That's why I keep calling him Shiyam. People might think why I'm not respectful. Dr. Shiyam, we never call him Dr. Shiyam. Okay. Yeah, we are hoping to train some people who have done basic counseling, and Shiyam offered to train them. So we'll see whether we can include some people from Colombo. So this is mainly for Kurna people. I'll discuss it with you, Shiyam, over the phone.
Okay.
Okay, thanks for coming.
Please send me some feedback so that I can.
Could we have your email address,
modify.
Dr. Shiyam? Could we have an email address to send you the feedback, inshallah?
Right, okay. MFM Shiyam. Yeah, I think I sent it to
chat. If you can put in the chat.
I do have Doctor's email address. I can share it with my team.
Okay, thank you so much. Okay.
Thank you so
Shall I
much. Wonderful session, Doctor. Thank you.
Yes, Assalamu alaikum.
Assalam.
Waalaikumsalam warahmatullahi wabarakatuh.
Sister Suha, I close the program, right?
Okay, you have to close the program for me to be able to convert the recording.
Okay, I'll end the session, right? Okay.
Okay.
Assalamu alaikum.
Walaikum salam.